Providers are well aware of the challenges of the large volume of data in the medical record, the difficulty in finding the desired data quickly, and the potential for clinical errors. Given the siloed display of data in CPRS, and the limited time during a clinic visit, the chart review may be very limited. This increases the risk of clinical errors, because the provider may not be aware of certain clinical findings. The Brillians Advisories are designed to address this limitation. Brillians analyzes a large volume of data and creates a short list of issues which do not meet the standard of care. Some advisories identify high-risk situations which require providers' attention, for example, malignant melanoma follow-up. The idea is to proactively advise the provider about such high-risk issues so that they can be addressed in a timely manner. A typical primary care visit is 30 minutes long. Due to walk-ins and other issues, the provider may actually have much less time than 30 minutes. Some specialty care visits are even shorter. The emergency room providers deal with complex patients under emergent conditions. During a typical clinic visit, the providers have a long list of tasks to finish. As the presentation shows, there are 10 distinct tasks during a clinic visit. Therefore, on average, the provider has about 3 minutes for each task. Please take a look at the slide, especially the item number 2. Can the provider effectively read and analyze the large volume of data in 3 to 5 minutes? Really? As a result, the provider may never see an important issue. Never seen? Never addressed. When performing a complex task, having a checklist ensures quality and safety. This applies equally to the flight checklist and the clinic visits. In Brillians, the advisories are the live dashboard of the clinical issues which need providers' attention. This is provider's checklist for the clinic visit. Advisories are based on the standard of care rules and the high-risk findings in the patient's medical record. Advisories are much more than just the numbers. They provide extensive data about the concerned topic. The advisories are one of the most powerful features of Brillians. They help providers get the things right in the first place and catch the previously missed findings. What are advisories? An advisory is a clinical issue which does not meet the standard of care, or represents a high-risk situation. Advisories do not require any work from the user. They are informational like the weather advisories. A click on an advisory displays detailed information, including the relevant historical data, about the concerned topic. Think of advisories as the chart review for the high-risk conditions. Advisories instantly provide the clinical data for the talking points for patient engagement. What advisories are not? They are not new work. The provider is expected to identify and address the abnormalities anyway. They are not the view alerts. They are not the clinical reminders. They are not just the numbers. They provide many details and talking points. They are not based on the stale, stored data. The advisories are evaluated based on the up-to-date, live, data from the VISTA system. What else should I know about the advisories? For a typical patient, expect to see about 10 to 12 advisories. A healthy, young patient may have no advisories. An elderly patient with many chronic illnesses may have many. The Brillians advisories are lightning fast. Within seconds, a single click displays lots of relevant data on the same screen. At minimum, the user should review advisories pertinent to his or her clinical role. Brillians strongly recommends reviewing all the advisories. The advisories cannot be turned off. A given advisory will not be generated once the issue is resolved. Brillians does not keep a log of the advisories shown to the user. What is workflow? Workflow is the sequence of discrete steps to go from the start to finish to complete a task, for example, a clinic visit. For similar work, one provider can finish a clinic visit in 25 minutes. But the other takes 40 minutes. Think, why? What is the difference? Analyze your workflow if your clinic visits frequently take longer than they should. Hint: I have complex patients is not the right answer. According to the management guru, Edward Deming, every system is perfectly designed to get the results it gets. If your system has you always running behind, then analyze your system of doing business. Those in the know that the workflow is the king. It determines the success of the process, no matter how simple or complex. Frankly, no process or tool will work well unless it fits nicely in the user's workflow. Therefore, the user should fine-tune the workflow to make best use of the available tools, for example, Brillians. Patients come to the clinic with an agenda. Where is the provider's agenda? What are providers' priorities? Think, advisories. Those who understand and fine-tune the workflow, and have a clear agenda, get to go home on time. The good workflow does not happen by accident. It has to be thoughtfully structured. Please consider the following broad steps in your workflow. We have more details later. Load patient's medical record in SupraVISTA. Greet and seat the patient and family. Make patient comfortable. For example, briefly talk about the weather, sports, children, patient's work or hobbies, etc. Provider's opening remarks set the agenda for the visit. They clearly outline what we are going to do today. During the visit, the provider takes interval history, does the physical exam, and explains important findings from the chart review and the physical exam. In the closing remarks, the provider verbalizes what was accomplished today. For example, inform the patient that all the meds are renewed, labs look good, entered a consult for this specialty, etc. Discuss plan for the next visit, for example, next appointment, and lab orders. When starting the visit, the provider outlines how the visit is structured. This informs the patient about what to expect. It also reassures the patient that provider will address all his concerns. At this point, the patient is seated, the medical record is open in SupraVISTA, and the provider has reviewed the relevant progress notes. The example narrative below applies to the new or follow-up visits. It may also be modified for the focused, urgent care, or walk-in visits. The provider uses opening remarks to set the agenda for the visit. For example, the provider may say the following. First, we are going to talk about if there is anything new, or something you wanted me to take care of. Then I am going to review the chart to see what needs to be done, take care of the physical exam, and any issues you have. Before we finish today, I will review the labs and renew all your medications. Most patients are concerned about their lab results, and having sufficient prescriptions refills. I will let you know if we need to do any labs or x-rays today. Here are a few tips about how to proactively streamline the clinic visit. It is very important to let the patient lay out his or her agenda first. This reassures the patient that the provider will address his issues. It also prevents interruptions due to patient's questions while the provider is focused on other issues. Note that spending 2 minutes listening to the patient will save many minutes later in the visit. Don't ask, "Do you have any problems?" We all have plenty of problems, so this does not help. Instead, ask, "Are there any new health problems or concerns since your last visit?" This sets the boundary and helps patient focus on the current issues. For the urgent care and walk-in visits, the provider may ask, "You told the nurse that you wanted to talk about X." As far as possible, Limit the unrelated discussion at this stage. If the patient interrupts, acknowledge by saying, "Yes, we will address this when I get to the physical exam," or the lab review, or ordering medications, as the case may be. Having stated his agenda, and having the reassurance that his concerns will be taken care of, the patient will focus on the provider's priorities, that is, the provider's agenda, without interruptions. Efficient workflow during the visit saves time. Multiple issues can be taken care of simultaneously as provider reviews the advisories. It is very important that the provider talks with the patient at every step. The most common patient complaints are that, provider never looked at me, and did not explain anything. At some point after listening to the patient's agenda, the provider should review the advisories. Let me look at your chart and see what is going on. The provider quickly reviews the advisories, and finds the issues which need discussion. These are provider's talking points. For patient engagement, find at least 2 positive things to say, even if there are not many positives in the advisories. For example, provider may say, "You have anemia for a long time. The good news is that it is not getting any worse." Here, the provider reframes that, "not getting worse," is good. Review each Brillians advisory and discuss a few with the patient as you go. For example, the provider may say the following: "Your cholesterol looks good. We checked the liver and kidney labs, and they all look fine. Who is taking care of your prostate cancer now?" These statements reassure the patient that the provider is aware of, and is monitoring, his medical conditions closely. Like the flight checklist, it is important to stick to the steps in your workflow. Do not let the patient grab the steering wheel of the visit. This way, the visit will be systematic, detailed, and still finish on time. Do all the steps in your preferred fixed order as far as possible. For example, take care of the history, physical, medication renewal, placing new orders, counseling, documentation, reminders, in the proper order per your workflow. If the patient interrupts, for example, brings up mid-renewal, while you are doing physical exam, politely say, "Yes, I will take care of it when I get to that part." But do not change the steps in your workflow. Pretty soon, patients will learn to wait, and will not interrupt at the wrong time. This ensures that the provider remains in control of the visit. Please talk to the patient at every step. It is a good idea to give a running commentary about what you are seeing and finding, such as lab and X-ray reports, skin rash, joint exam findings, etc. This informs and engages patient in what is going on. This also addresses the patient's health anxiety about the various issues. Many such issues may sound trivial to the provider, but they are important to the patient. The smart use of advisories allows the providers to complete the visit quickly by combining multiple tasks. For example, reviewing the clinical data, explaining it to the patient, and placing related orders, can all be done together. And we can do all this while keeping the patient engaged in the process. The provider uses the advisories to find and explain the numbers about the lifestyle issues, and whether they are good or need improvement. Please discuss the risks, but do not go into the critical parent mode. The critical parent does not work. If it did, we all would be model citizens by now. If needed, place the orders in CPRS, as you explain the data from the advisories. For example, the provider may say, "Last time, your bad cholesterol was a little high. I am going to order the labs today." At this point, the provider enters order for the desired items in CPRS. Needless to say, these could be any orders, for example, labs, imaging, consults, prosthetics, etc. With this approach, within the first 12 to 15 minutes, the provider has addressed the patient's and The provider's agenda. The provider has explained the important clinical issues, has placed most of the orders, and has kept the patient engaged during the visit. This leaves plenty of time for documentation, reminders, and other tasks. Formally closing the visit is important. In closing, the provider summarizes the findings and the actions taken during the current visit. It also lays out the plan for the next visit. At this point, all the work is done. You have taken care of all the business, but does the patient know that? Summarizing the findings and the actions taken during the visit reassures the patient that provider took care of everything. This reduces the health anxiety and the phone calls between visits. Here are some examples of the closing remarks. I have renewed all the medications and you should have no problem until your next visit. I have looked at the labs. They all look good except cholesterol. You know what to do about that. I have entered consult for the foot doctor to see you. They will call you and make an appointment. We need you to do labs before the next visit. Your next appointment will be 6 months from now. Please call the clinic if you need anything before that. In any process, a carefully designed workflow creates efficiencies and improves the outcomes. We know the VIA providers are providing the very best patient care. But how does the patient know that? Hint: talk to the patient at every step of the visit. As we grow older, health is a major concern and a source of anxiety, especially the anxiety of not knowing what is going on. The key to patient satisfaction is to address the patient's health anxiety. The Brillians Advisories make it super easy and efficient to find and communicate the clinical findings, which address the patient's concerns and anxieties. The providers deal with many complex and demanding tasks every day. To ease the burden, we need to take full advantage of the workflow and the tools available to us. Sometimes, this involves analyzing and rethinking how we do the business. Addressing the patient's health-related concerns and anxieties is central to good patient care. Just knowing that the provider is taking care of the issues helps reduce the anxiety. Smiling, eye contact, and appropriate gentle touch help build a trusting, friendly, and professional relationship. Keep your promises to build trust. If you promise, we will mail your meds, then make sure it happens. Do not turn into a critical parent. We all tune out the critical parent very quickly. Changing habits is difficult for all of us. Further, the patient may have challenges we do not know about. Be sensitive to the patient's personal, social, and economic realities. The cholesterol level is least of the patient's concern, if he is not able to pay the rent. Every now and then, have a gentle, small talk about whether the patient is having any difficulties in personal life. Not everyone is as blessed and privileged as many of us. Therefore, above all, please be kind and understanding.